Gynecologists want 6 menstrual problems you should never ignore. None of us won't mind if we skip one menstrual cycle, but we should always pay attention to the symptoms and the problems during our cycle. The gynecologist warns us about this kind of irregular symptoms and they should not be ignored. Skip cycle, reduce or excessive bleeding can be the sign of some serious problems. These symptoms are a signal that you should go to see the gynecologist. 1. Absent menstruation. If you have 2 or more menstrual cycle, eczema can be a reason for few not really good things. The reason can be hormonal imbalance, thyroid problem, excessive workout, or diet, stress, or premature menopause. The absent menstruation can lead to higher growth of abnormal cell. Except the usual treatment, your gynecologist should do a blood test and check your hormone level, your thyroid, and he can check do you have polycystic ovaries. 2. Sudden and intensive cramps. If you have cramps that cause your unbearable pain, you may suffer from endometriosis. Endometriosis is a condition in which the cells that grow inside the uterus are starting to grow even from the external wall of the uterus, and they cause bad and abdominal pain. The symptom can show up anytime, and the most of the women who are diagnosed with this type of problem usually had painful menstruation from the time when they were younger. 3. Abnormal bleeding. If you notice abnormal bleeding between your cycle, that can be completely normal, especially if you are taking birth control pill, but still you should go to see a doctor. It can also mean that you might have ovarian cyst or precancerous cell. 4. Excessive bleeding. What is actually excessive bleeding? If you change your insole every hour, that can be called excessive bleeding. This can be a symptom of some medical problems like fibroids, polyps that can cause anemia. The kind of condition require urgent medical intervention. This can be a sign of hyperplasia. 5. Unbearable symptoms of PMS. If you are turning yourself into some kind of monster, you probably suffer from premenstrual disorder, which is incompletely worse than the classic premenstrual syndrome. This symptom include uncontrolled cravings of food, change in your mood, depression, great anxiety, rage, and losing your own control. These symptoms can be very unpleasant, but with this talking antidepressant for 2 weeks or 1 month, it can make a huge difference. 6. Distress hormone. Something during your menstrual can get much worse. If you suffer from asthma and you feel very bad a week before your cycle, you should know that's not coincident. This is phenomenon known as premenstrual magnification, where conditions like diabetes, depression, or arthritis get much worse during the menstruation. You should consult your doctor about the medications you should be drinking before the cycle, and it will help you to feel much better. Thank you.